Hello friend, today we will discuss about LFTs or liver function test. The liver is the largest organ in the body. It is located below the diaphragm in the right upper quadrant of abdominal cavity and extend approximately from the right ribs to the lower border of rib. The working cell of liver are also known as hepatocytes or hepatocytes. Liver regenerations can occur after surgical removal of portions of the liver or after injuries that destroy part of liver. Although the liver ability to react to damage and repair itself the remarkable, repetitive can produce liver failure and death in souls. Functions of liver. Metabolic functions. Liver actively participate in carbohydrate, lipids, proteins, minerals, and vitamin metabolisms. Excretive functions. Bile pigments, bile salts, and cholesterols are excreted in bile into intestine. Hematological functions. Liver participates in formation of blood, particularly in embryo. Liver is also produces clotting factors like factor 5 and 7. Fibrinogens involved in blood coagulations is also synthesized in liver. It synthesizes plasma protein and destructions of erythrocytes. Storage function. Glycogens, vitamin A, D, and B12 and trace elements. Irons are stored in liver. Protective functions and detoxifications. Ammonia is detoxified to urea. Kupffer cells of liver perform phagocytosis to eliminate foreign compounds. Liver is responsible for the metabolisms of bilirubin productions, bilirubin processing, and bilirubin excretions. Plasma bilirubin. Normal plasma bilirubin is 0.2 to zero point 0.8 milligram per deciliter. Unconjugated bilirubin is 0.2 to zero point 0.6 milligram per deciliter. Conjugated bilirubin is 0 to zero point 0.2 milligram per deciliter. If the plasma bilirubin level is exceed to 1 milligram per deciliter, the condition is called hyperbilirubinemia. Level between 1 and 2 milligram per deciliters are indicative of latent jaundice. When the bilirubin level exceed 2 milligram per deciliter, it diffuses into tissue producing yellowish discolorations of sclera, conjunctiva, skin, and mucous membrane resulting in jaundice. Icterus is Greek term for jaundice. When the birds test for bilirubin. Principle: diazidosulfonilic acid react with bilirubin to form purple color azobilirubin. Direct and indirect reaction. Bilirubin is such a insoluble in water. The conjugated bilirubin is soluble. When the bird's reagent react with conjugated bilirubin gives the purple color immediately after within 30 seconds. The direct positive when the bird's reaction additions methanol alcohol dissolves and conjugated. If the serum contains both unconjugated and conjugated bilirubin in high concentrations, the purple color is produced immediately. Direct positive, which further intensified by additions of alcohol. Indirect positive. The type of reaction is known as biphasic. Useful in understanding nature of jaundice. This is due to jaundice is characterized by increased serum concentration of unconjugated bilirubin, hemolytic conjugated bilirubin, obstructive, or both of them, hepatic. Indirect positive, hemolytic jaundice, direct positive, obstructive jaundice. Biphasic, hepatic jaundice, bilirubin in urine. The conjugated bilirubin being water soluble in excreted in urine. Bilirubin in urine. The conjugated bilirubin is water soluble and excreted in urine. The conjugated bilirubin is not excreted. Bilirubin in urine can be detected by Fitch's test or Gamma-glutamyltransferase test. Major liver function tests may be classified as follows. Test based on excretive function, measurements of bile pigments, bile salts, and bromosulfothylene. Test based on serum enzymes derived from liver, determinations of transaminases, alkaline phosphatase, nucleotidase, and Y-gluta or gamma-glutamyl transpeptidase. Test based on metabolic capacity, lactose tolerance, antifurin clearance test based on synthetic function, prothrombin time, serum albumin test based on detoxification, hypuric acid synthesis. Number 1. By bromosulfothylene test. Additional tests. The most important tests are including aspartate transaminase, or also known as SGOT or AST, aspartate transaminase, or serum glutamate oxacetate transferase. Aspartate transaminase normal range 10 to 45 unit per liter. AST is found in both cytoplasm and mitochondria. AST or GOT also reflects damage to hepatic cell, is a less specific for liver disease. It can also be released with heart muscles brain disorder. AST help to diagnose various heart muscles or brain disorders such as myocardial infarct, heart attack. Elevated level of AST may be indicate acute hemolytic anemia, cirrhosis of liver, hepatitis, acute pancreatitis, or inflammatory of pancreas. ALP occur in all tissues, especially liver, bone, bile ducts, kidney, and placenta. The ALP is used to help diagnose certain liver disease and bone disorder. Normally, it's 13 to 95 international unit per liter. Oh, I'm sorry. I think I'm gonna be so upside. Here we will start it upon there. AST, SGOT.